and welcome to this MIPIM Connect session on the role of the built environment in improving health. I'm very pleased to welcome Louise, Brooke-Smith and Joanna for this discussion, and I just want to get them to introduce themselves and set the scene a bit to the discussion. So perhaps Louise, you could start.
Thanks very much, Stacey. I'm Louise Brooke-Smith. I'm a chartered planning and development surveyor and town planner. I've had about 30 years experience in the public and private sectors, both in the UK and overseas. And I established a long-standing planning consultancy, which I then sold to Arcadis and became a partner and UK head of strategic planning and social value. I stepped down from the partnership last year to take up a portfolio of roles and advisory positions around the world. I have a huge passion, I hate that word, but it is a passion for social diversity and inclusion. And I regularly comment on the links between real estate and well-being.
Joanna.
Thank you. Good morning. Joanna Frank. I'm calling today from New York City, where we're based. I'm the president and CEO of the Center for Active Design. We are a nonprofit organization based in New York, but we work globally. We were actually launched by Michael Bloomberg at the end of his administration as mayor of New York City. And during that time, I was director of Active Design, which was a program which was kind of groundbreaking, that really looked at how do you take public health research and data and translate that for all facets of our built environment. So how do you use that information to optimize our built environment for people, whether it's infrastructure investment, public buildings, housing, whatever it is. Active Design started at really looking at physical activity, but in the 10 years since the Center for Active Design has been working, we've expanded to really look at all facets of health. So yes, physical health, but really also mental health and social cohesion as well. And I'm going to be talking a lot about the kind of mental health aspect of our current crisis, because I feel like it's the least discussed, even though we know so much about how our built environment impacts our mental health. So it's great to be part of this discussion.
Great, thank you both. When this session was first conceived, it was before the COVID crisis. So I want to kind of start off by going back and having a little bit of a look at the landscape pre-COVID and where we were with the built environment in terms of its role and the role that it plays in health and well-being. So Louise, I don't know whether you want to start.
I'm happy to. I think by actually talking about what groups and individuals are addressing now, it will highlight how far off we were previously. And I actually think that COVID-19, it's been an incredible catalyst for action. So there is a positive that comes out of this. And certainly in the UK, we've been wrapped up in red tape and an old-fashioned culture, and this has been an opportunity to move things forward. So notwithstanding the horror of the pandemic, we really have an opportunity to embrace and put into real practice all the digital systems that we've had to take on board and take health and well-being very seriously. But as well, keep watching the bottom line in terms of investment return for real estate. And there are three key areas that seem to be coming through which highlight where we were before. We can and we are adopting appropriate design to support healthy living. I know Joanna and I are going to talk a little bit more about that later. But we also, from a business point of view, are now seeing a far more positive attitude to ethical investment and social value. And last but not least, we've got a realistic application of improved land use policy and regulations. So the push to embrace well-being is on everybody's lips, no matter where you are in the world. But I think it is a real eye-opener to see how it affects our construction and real estate industry, and that the sustainable demands in the investment markets are really responding to this. And so our technical applications, modern methods of construction, particularly in the UK with leadership from Mark Farmer, and major house builders who are looking at this in far more detail and far more from a business point of view than ever before. Innovative solutions to water supplies and water systems. I'm lucky to be working with Polypipe at the moment, and the innovation that's coming out of that company in terms of how to incorporate far more intelligent and clever design and attention to air quality as well. So they are becoming far more the norm in terms of our real estate, what it looks like, where it's built, and it's shaping at every scale, a local scale, regional scale, new settlement scale, you know, whether or not it's new local neighbourhoods having an input and an impact into what their areas look like and the impact that has then on how people live, work and play. We know that the impact of health and well-being on our economy, particularly, I'll talk about the UK in more detail, is significant. The lost working days equate, the research recently undertaken by Public Health, it comes to about 7.4 billion sterling in the UK alone in loss to the economy. The increasing mental health issues, which I know Joanna's going to pick up on in more detail, is huge in lost working days. 1 in 6 deaths in the UK is through heart disease. 40,000 deaths relate to poor air quality. This is all to do with our built environment. And so we've got a fantastic opportunity to do something about it. To prevent obesity by looking at clever, intuitive design in how we build, not just huge settlements, but, you know, the stuff in our local streets, how we can link social care and healthcare into one sector. That's fairly important to the real estate industry. The inevitable, what are we going to do with all our offices? Now we don't really need as much office space. What else can they be used for? And how can they be adapted properly through potentially planning regulations and still create space that is appropriate for communities to use? And there's been a lot of criticism about permitted development rights in the UK. I know that government is looking at improving those and bringing out the new white paper over the next few weeks. The US has got a very different planning system. The zoning system adopted in many parts of the US introduces its own issues that also introduce aspects of you know, good design and the impact on well-being. Climate change, you can't go through something like this without mentioning climate change, and to embed zero carbon. You know, the number of authorities around the UK that are addressing this head on now, would they have done that without COVID-19? I'm not sure that they would have pushed ahead as quickly as they are doing now. So just to conclude my sort of opening remarks, I see COVID-19, yes, it's a horrific pandemic, but it's also a catalyst for change, and I think we should embrace it with both hands.
Joanna, that's obviously a great scene setter. Thank you, Louise. Joanna, from your perspective, is this something? Would you agree that the COVID crisis has accelerated the thinking or changed the thinking compared to kind of pre-COVID, and sort of, you know, what level were things at before, and kind of where are we now?
Sure, absolutely. So I totally agree with Louise that yes, we are in a new kind of reality, and I am also very optimistic that we can see the kind of movement forward that we weren't really seeing that kind of traction before COVID. So, but let me just talk about where we were before, so you can kind of understand the trajectory of where this was heading. So before COVID, we were already seeing a real increase in demand for health promoting environments, whether it was a workplace or at a residential scale. So 75% of the workforce in the US was demanding health and wellness, and actually said that it would affect their willingness to stay in a job, or it affected their choice of where they wanted to work. So in a very tight labor market, which we had 6 months ago, it was really a kind of top of mind as far as retention and attraction of staff. So we were already seeing individuals demanding health promoting environments, and that was driving businesses to require that of their landlords, of their building owners. So that was kind of one of the reasons we were seeing a real demand for health and wellness. We run the Fitwell Healthy Building Certification System, which is a global certification. It was actually started by the Centers for Disease Control and Prevention, the CDC. I used to have to explain who they were. I don't think I do anymore. So the CDC created Fitwell from the global evidence base of public health research. and created a healthy building certification. So we have real-time data as far as what the demand is. Fitwel is very new. Fitwel is only 3 years old. And I think that that also demonstrates that this is a new demand that we were seeing as far as real estate was concerned. On the other side of the equation, my background is actually as a real estate developer. So just to kind of get into the finance of it all, we were seeing already a strong demand also coming from investors. So investors globally, especially institutional investors coming from pension plans, coming from sovereign wealth funds, were looking for investment opportunities that were meeting environmental, social, and governance metrics, with the environmental and the governance way outperforming the social. So S, health, the middle, actually only accounted for 14% of reporting as far as ESG metrics are concerned. So we already were seeing kind of an increase in traction. We have a great partnership with Fannie Mae, the big financial institution over here in the US, because of that ESG interest. They were looking to create another opportunity to sell bonds into that market, mortgage-backed securities into the ESG investment market using health metrics. So very interesting that that was already happening. Now, I was just on the phone with a big pension plan a couple of days ago, and they were saying that it used to be a discussion of return on investment. We used to talk about how to differentiate your portfolio based on health, but it was a choice. Now it is an essential facet of real estate. Basically, the first question that you have to answer now is not how am I promoting health, but how am I mitigating the risk to health with my buildings, with my real estate, with my portfolio, and at a neighborhood scale also. So there has been a paradigm shift. I mean, health is now an essential facet of real estate, of the real estate business, from all levels, whether it's demand from individuals or demand from investors. And the real estate industry is up for the challenge. I mean, we see nothing but an interest and an appetite to really learn how to prioritize buildings, whether they're existing or whether it's new construction, whether it's the large scale, kind of neighborhood scale, master plan community, or whether it's individual buildings. And we're having these conversations globally. So we work in China, we work in the UK, in EU, North America. We're having a tough time. So Canada's doing okay. Having very different conversations with our partners in Canada than we are with the US. Yeah, where to even begin with the US, but still, we can certainly talk about challenges that we're facing.
Cool. Before I bring Louise back in, I just wanted to pick up on a point that you were talking about. I know there's been a huge push in recent years to sort of show the value of ESG, and I know certainly in the UK there's a push to try and get it as part of the overall valuation, the standard valuation process. Do you think that is the biggest stick for the property industry, coupled with kind of demand? Because, you know, it's the question is, they're going to ask what's in it for me ultimately, because it's all very nice to have healthy buildings and stuff, but ultimately it comes down to what's in it for them. Is it going to make their building more valuable? So is that the biggest stick, or has the shift in thinking because of COVID and the fact that health and well-being is right up there now, is that a bigger stick now?
I would say that the risk that COVID has exposed to the real estate market is undeniable and very motivating. And ESG, actually, the properties that were meeting ESG metrics, the market has actually been more stable over the last 3 or 4 months. So it has once again demonstrated that companies that are meeting those ESG metrics are probably doing a lot of other things right as well. You know, so these do represent companies, whether they're real estate or other companies, that aren't just meeting ESG metrics, but you know, they are well run and the most, I would say, stable investment. Certainly that's what we've seen in the last few months, and that's what we were seeing prior over the last decade. So I would say, as a recovering real estate developer, that yes, it is all about the money, right? I mean, it is your fiduciary responsibility first and foremost, but also you can't build a building unless you can finance it. You can't renovate a neighborhood if you're a city unless you can finance it, right? So it doesn't matter whether we're talking about bond financing or whether we're talking about individual financing. We have always looked at changing the underwriting of financial institutions. Like we are, yes, we're interested in individual projects, but that's not really the point. We want market transformation. And to get market transformation around health, we're really looking at how do you leverage a standard like Fitwel into the underwriting. And that's why we partner with folks like Fannie Mae, because they have changed their underwriting standard so that health is now up there with sustainability and with other facets of good business, because there is a cost benefit to promoting health, and there is a risk mitigation strategy around promoting health, whether it's a stable tenant, whether it's differentiation in the marketplace, whether it's a more stable workforce. I mean, there's lots of ways that we used to make the return on investment argument, and people would be somewhat persuaded. And now I think we get to do it all over again, and people will be persuaded now.
Cool. I wanted to bring in Louise. I know you mentioned that there are challenges, and we'll come on to talk about those in a moment. Perhaps we should maybe talk a little bit about some of the things that the built environment is doing and can do in order to help improve health and well-being. And I know you touched upon a few of these in your intro. But what should the industry, what is the industry doing now, and what should it, or what could it be doing?
Well, for a start, it's moving in the right direction, which is a positive, and we should be celebrating it. I'll pick up just a few of things that Joanna was talking about there. That ESG is becoming so much more important. It's really rising up the ranks. I spend quite a lot of time looking at social value and looking at how social value can be embedded into the built environment, into the planning system, into the management, property management systems. And the key aspect here, and forgive me, I won't go over the ground that Joanna's mentioned, but the values is the paramount. That is what is making such an impact, certainly for the FTSE, top 100, top 250, the investment that's coming in, it isn't just looking at the bottom line, it's looking at how companies have got to that bottom line, their ethics. And it's that ethical approach, which is, from my point of view, a massive sea change. That has come about through far more transparent means of transaction. The digital age means that information is so much more easier to get. You can't hide behind smoke screens and mirrors. It is out there, and people can actually start probing and asking questions about how do property companies make their money? How should investment be spent? So there is more visibility and there's more transparency, which is great, because that money that's coming into the industry from all around the world is looking for embedded resilience in their property, in their portfolios. They're looking at flexibility in use. So that means clever design. It means clever use of materials and use of appropriate materials. Grenfell has had repercussions around the world, and it's still not resolved. It's still ongoing. Hit the press again this morning. But zero carbon, green, all of those aspects which were until relatively recently seen as nice to have are now very important to have. And I certainly, the schemes that I'm involved in, and therefore large residential inner city developments to new settlements, looking at the green belt, making best use of green belt, the moral and ethical approach to what's coming out of the ground and how it's being designed is really important. Not only that, it's the management of land and property. I'm honoured. I sit on the board of the Land Trust in the UK, and we partner with a number of major developers, house builders across the country, where we're introducing effective management. That's not just looking after the green bits, that's looking at social cohesion, community cohesion, giving an improved sense of social, improved social interaction, because it all comes back to what we are building, where we're building, how we are using it. And there's been so much research done on the links between good health, good design. The Building Beautiful Commission which the government is still in its throes of responding to, introducing, what our built environments look like. How do you travel between our built, one centre? How are we going to be dealing with our high streets in the demise of retail as we once knew it? Access to green space, the amount of landscaping that needs to go into those green spaces, and it's not just a tick in the box. The work that the Landscape Institute is doing in the UK is phenomenal, and it's really impressive. And I mentioned that particular institute, not at the to avoid others. Certainly the RICS, the CIOB and RIBA, which are the British architects, have come together with the Construction Innovation Hub to look at exactly this, how to embed properly, much in the way that sustainability is now sort of accepted, how to embed well-being and good design in everything that is built. And it is happening. MMC, Modern Methods of Construction, and innovation that is coming through now, and the impetus for it is huge. It is really good news. And even, an organisation like the UK government is actually getting on with it. They're not just talking about, comparison, you might not like everything that they say, but at least they're getting on with it, and they are making changes, because I think they realise that now is an opportunity to move. If we don't do it now, if we don't embed that well-being into our design, we'll never do it. We'll always be retrofitting it, and it will just literally be an added cost and seen as a sort of a pain, as opposed to actually tackling it now, getting it right. That affects markets, that affects investment, and more importantly, it affects positively the people who are going to use those buildings, live in those homes, use that open space, and it has to be people orientated. So that is the key underlining message which I'm seeing coming out of real estate investment and management, is that people matter, and take them seriously from the start. Don't retrofit people into these schemes afterwards just because you've got to hit a certain figure, a certain bottom line.
Joanna, I know you mentioned that it's tough in the US with the messaging. What positive things are you seeing the real estate industry doing? And we'll then come on and talk a bit about the challenges, because obviously it's great that things are happening and that it's risen up the agenda, but they're obviously going to, it's not an easy fix, and it's not an easy thing to do. So we'll talk a bit about the challenges after that. But perhaps you can talk a bit about the landscape where you are, in terms of some of the positive things that are happening.
Yeah, absolutely. So I'd say actually it isn't that hard a fix. It's just a case of shifting your priorities. Nothing that we're talking about making people-centric environments, none of it is rocket science. None of it are strategies that you aren't already doing somewhere. It's really about, like, how do you prioritize those strategies within a single project? And how do you understand that the effect that you're having, and therefore make the kind of informed decisions about what to prioritize for specific communities? I mean, what we're talking about here is making streetscapes that are at a scale of people, creating walkable environments by planting trees and having seating, which is maybe counterintuitive, but there's plenty of research that shows that more people, especially vulnerable populations, are more likely to walk down a street if there's benches for them to take a pause. So none of these things are rocket science. None of them are even that expensive. And we are already affecting people's health by the decisions that are made. We have prioritized cars and car-centric environments over the last 50 years by choice, because that is what we wanted to prioritize, right? As a society, we've said the car is going to take precedence when it comes to our planning, when it comes to our land use policy, when it comes to a lot of facets of our design. Now we're shifting and saying, no, people are more important than cars. And now we're going to shift to really like understanding how to create those environments so people will thrive, not just so that they won't get COVID, but let's kind of broaden the conversation. So we just actually put out a publication last week about the strategies that the real estate industry can employ to mitigate viral transmission. And so very important that the real estate industry understands that you can mitigate viral transmission. You cannot eliminate it. You cannot create a COVID-free building, some of these other things that I've heard folks talk about. So mitigating viral transmission using the building mechanical systems, using cleaning protocols, using policies around social distancing, mask wearing. HVAC is good at kind of mitigating the aerosolized transmission. Humidity is good at reducing the risk of the larger droplet transmission, as well as obviously that social distancing, whether it's 3 feet, 1 meter, 2 meters. Everybody seems to have a different distance, but the primary transmission is that person-to-person transmission. So we just put out that publication, so folks can just download the whole thing. But that was just chapter 1. Okay, viral transmission. It was chapter 1 about how to respond to COVID, because what you really need to be looking at it is holistically. COVID is also affecting mental health terribly. So the UK actually was already suffering massively from mental health outcomes. It is the #1 source of disability globally. So employers were already massively impacted by mental health. The UK on an average year was being affected 70 billion pounds of loss of work due to mental health issues. So mental health was already in a really bad state pre-COVID. And we just basically ticked every single risk factor for mental health: social isolation, increased stress, loss of employment, lack of security, lack of safety. Like all of these things are only going to increase the levels of anxiety and depression amongst the whole population, which will affect obviously the employed population as well. So it's in everybody's interest to really think about this holistically, that yes, you have to mitigate viral transmission, but you also need to be thinking about how to optimize environments for mental health and also to address the disparities that we see across our populations. So the work we've been doing over the last 10 years is really looking at chronic disease and how to limit the risk of chronic disease by looking at behavior. So some of the key risk factors for chronic disease are physical inactivity, social isolation, and smoking. Your built environment really informs all of those behaviors. So we already know so much. Fitwel has 5,600 peer-reviewed research studies from academic institutions around the world. There is so much knowledge from the academic institutions. Public health knows how to do this. It's us on the real estate side that are catching up. So we don't have to learn this from scratch. We don't have to say, oh, I wonder what's going to affect health. I wonder how I should optimize my building, my neighborhood, my street. We know how to do it. It's just the real estate industry doesn't necessarily know how to do it. So this is actually why I'm optimistic. It's not like sustainability. Sustainability 20 years ago was starting from whole cloth. They didn't have public health experts on the other side who'd been looking at it for 100 years. So we are in really a better position in that there's already this body of evidence. There's already great precedents about viral mitigation from 100 years ago. We are not making this stuff up. This is evidence-based. There are metrics behind it. All the things that I know my colleagues in real estate like: numbers, lots of numbers that we can talk about.
Bottom line numbers, yes.
It's not an opinion that we're talking about here. This is based on research, a body of research. So I just want to kind of like keep harping on that stuff. We don't have to make this stuff up. There is so much that is known. That we might...
Sorry, Louise.
That's okay. I think you've really you've pinpointed something. Sometimes there's so much information you can drown in it, and it's a matter of seeing the wood for the trees sometimes, and just not getting back to basics, but just making sure that the absolute obvious messages don't get lost in the sort of sea of the research. I mean, I'm doing a piece of work at the moment on air quality and road air quality and how it relates to planning in the UK. And you start looking at how much research has been done. It is phenomenal, which begs the question, why hasn't somebody joined up the dots and, had brought it all together? The critical thing I think that we can get out of that is looking at the built environment real estate industry, the sector, it's to move away from the silo mentality, which has been prevalent for so long, and start looking as a built environment sector as opposed to the surveying sector or the planning sector or the health sector. If we can have any influence on bringing the various key sectors, key industries together, there would be so much sharing of good practice, and things could move forward a damn sight quicker than they have previously. COVID-19 has helped speed things up. So I am pleased to see a lot of the collaborations between, for example, the professional institutes around the world, whether or not it's the planning institutes, the surveying institutes, but there is a far better appetite to be working together rather than point scoring. And I think that might cut through the huge amount of research that's been done, and we don't start duplicating it again.
Sure. Yeah, I mean, we spend our time translating that research body for like practical implementation at all scales. So with Fitwel, actually, we just expanded into a site scorecard to actually exactly what you're talking about. We now have a residential community site scorecard that brings all of these facets together into strategies that cover local hiring practices, as well as design, as well as amenities, because it all makes a difference to that holistic health outcome. So the trust and social cohesion piece, you know, is just as important as the kind of walking piece as far as health is concerned. And again, we know how to do that. We know how to create communities that people are more likely to trust one another. There is research around that. It feels very esoteric for real estate. Like, how could you possibly measure trust? Just because we don't know how to measure it doesn't mean it's not measurable. It is measurable.
It's like social value, isn't it? Social value has been a real issue for so many different organisations and companies, because they like the idea of it. It sounds lovely. And then they get to the point of how do you measure it? And it is not impossible to measure the impact of social value. It's not easy. And, you know, the terms of reference and, you know, the measuring tools, you know, need some intelligent addressing, but it can be done. And there's some very good organisations around the world who are doing it successfully. But people have been frightened off because it can't be measured. Bloody well can be measured. So I think, you know, there are a lot of people now who are realising that it's not simple, but it's really important. And I think that ties well into what the work that you're doing over in the States.
Yeah. But I would also kind of go back onto that demand piece. 10 years ago, when we started this piece of work, there was no demand for this, right? We had the active design guidelines. Michael Bloomberg was the big spokesperson for it. He couldn't sell the active design guidelines, right? We were jumping up and down trying to get folks to pay attention to this. And there was a direct correlation to business that we could make. Even then, we could, like, you know, demonstrate that this was good for attracting business, etc. That's why New York City did it in the first place. It was really to position New York City in the world stage to attract business, right? We didn't do it for health. We did it for quality of life and business.
And it was very successful. I remember looking at some of the case studies based in New York, you know, whether it was Highline or whether it was making use of redundant car parks and getting them back into pocket parks. And it was innovative. I remember to work that you're involved with, and Bloomberg was progressing at the time, and it was, you know, it was show-stopping in some of the presentations. This is what they're doing in New York. We could do it here, and they we never thought of that. And it was really important stuff that now is being adopted across the world. So it is, you know, it's taken a bit of time to land, but it's now top of the agenda. I work a lot in Birmingham in the UK, and the Route to Zero plan that they're pulling together in Birmingham, and a lot of the principles that originally played out in parts of the US and Australia actually are now becoming, you know, straightforward policy. Let's get on with it. And so, well done. Thank you very much.
That was a big team.
But it has an impact.
I want to finish off. Obviously, we've spoken and set out the case for how things have accelerated rapidly in the last few months because of lockdown and the COVID crisis. But I wanted to finish off by just looking ahead. Obviously, we've made great progress in the last few years, but looking ahead to sort of 3 to 5 years time, what will the role of the built environment be in health and well-being? What should it look like, and what will it look like, do you think? Maybe you can start, Joanna. Oh, sorry, Louise.
Sorry. I think one of the areas which is really taking off has to be the way that we build. It has to be more effective and quicker, but yet still be able to adopt the quality from a well-being and health point of view. And it can be done. I don't think it can be done as easily in the established means of construction. So I am a very strong advocate of MMC. I think that will take off, providing there are some checks and balances in terms of not getting stuff out and speed being the critical matter. It's quality. And I've seen some fantastic examples of where quality modern methods and precision engineering can work really well. I think that will increase. I also feel that some of the regulations and red tape, certainly in the UK, do need looking at. Every few years, governments try to reinvent the planning system, but at the moment it isn't ideal. It's under-resourced. So I think that those areas, policy, practice, and a clear engagement and acknowledgement that well-being is critical. It's critical for a healthy community to move forward.
Joanna?
Sure. Well, judging by the conversation and the work that we are now doing, which were not doing 6 months ago, we're now working with some of the big global real estate companies who also work in the UK. So it's coming to you too, to really look at every facet of their business and how to embed health into each facet, whether it's their acquisition strategy, whether it's the design guidelines, whether it's how they manage their existing properties, how they communicate with their tenants, how they're reporting on success, and how they're talking to their investors. So we are adding health at every juncture of these big corporations, and judging by who we're working with, it's going to evolve across the real estate industry globally, because these are the big global players. So it's a fantastic conversation to have, because we already know how to do this. This is actually what we did in New York City. So we didn't just come up with a pretty book called the Active Design Guidelines, which was important. But what we did before we left the administration was actually change and solidify all of the facets of the active design into policy. So we changed the contracting process. We changed the procurement process. We changed the underlying design requirements of New York City, and we backed it all up with an executive order making it mandatory. So all New York City funded projects, it is mandatory for them to use the active design guidelines. So that is the kind of shift that we are now looking to replicate on the private practice side. And that the demand just wasn't there even 6 months ago. I mean,
it's absolutely right. It is now being adopted and encouraged and embraced, and not only in Europe, the States, Australia, but also in the urbanizing parts of the world. Huge parts of Africa are realizing that they can leapfrog. They don't have to go through that horrendous learning curve. And I don't mean that to sound really patronizing, but there are a number of initiatives, government initiatives in Sub-Saharan Africa, that are realizing whether it's a digital impact, whether or not it's adopting health as a key major criteria. They can, those administrations, learn so much, and without having to go through a painful learning curve, they're getting on and doing it, which is really, really good to see. So that it's not just the the London, Tokyo, New York parts of the world. It's other parts as well.
Great. Thank you, Joanna. Thank you, Louise, very much. It's been a really interesting discussion. Thank you very much.
Thank you.